Hi, Sylvain from Mancuso Clinic, and today I want to do a video because this week I had few patients coming for back pain, lower back, hip issue, knee issue, and this patient came for this type of pain. But at Mancuso Clinic, our job is to find the root cause of the problem. And for this patient, the root cause of the problem was not the lower back or the hip, it was the feet. And today I want to talk about the importance of the foot mobility to reduce the risk of injury on your knee or on your lower back. First, I want to talk a little bit of anatomy. You can see we have two drawing, one of the foot. Then you can understand then when you look at the foot, there is a lot of joint involved. The cuboid and the calcaneus here, all the front of the foot here. But the important things I want to show you is all the muscle going around the ankle on the front foot, but on the back of the foot too, with the importance of the calf muscle, which is going to change the mobility of your feet. And at the same time, if your foot doesn't do the job, I want to show you with this shim. Then you can see the there. Sorry, let's do that here. Clear that. You can see how the foot is completely related with the lower back, because you can see all the muscle come from the lower part. Okay, let's do that there. Come from the lower part of the leg, going up and following the calf, but the hamstring too, and go to the glute. You need to understand that all the leg is the same fascia, is the same bag, which is going to bring the tension from the lower part of the leg, is going to bring that up, but at the same time, the tension of your upper or lower back here is going to go down too. And it's completely related. And in the case of these two patients, we can see that this issue was come from the ankle not moving. And how we can move your ankle. The first things when we talk about mobility of the ankle is to do a self-mobilization. You take the foot and you move the foot to help the mobility of the bones and joints. At the same time, you understood with the first sham that all the muscle involved in the mobility of the foot needs to be stretched. The calf is a big one. You can stretch the calf in two ways, just these two muscles, the twin, or with the soleaire, then it's another muscle, then you can just stretch your calf and it will help the mobility of your foot. In the same way, you need to understand that the mobility of your foot is related with the hamstring, because the tension in the back of the leg can increase the tension on your foot. Then if you want to improve the mobility of your ankle, you can walk barefoot too. It will help your foot to move better. Walking on the dry sand will help your foot to adapt to the ground and help you to have a better mobility of the foot and reducing the risk of putting too much pressure on the hip or lower back, because the foot is not doing the job. The other things you can do to improve the foot, and because sometimes we talk about flat foot, and go to see an orthotist who is going to tailor-made the right orthotics for you. will help you to reduce the risk of injury on the foot and improve the mobility of the foot to feel better and reduce the risk of putting too much pressure on the lower back and all that. What I want to talk is about the holistic approach to at Mancuso Clinic. As I said, these two patients came for a lower back issue. One was the lower back and the other one was the hip issue. And our team approach and the holistic approach at Mancuso Clinic is to go to the root cause of the issue and not only see the symptom, because if it was the symptom, I will just focus on the lower back and I will miss the root cause of the problem. That was a bad ankle mobility. When we moved the ankle, immediately the lower back was better because less pressure was coming from the foot to the lower back. If you have any question about lower back issue or knee issue or ankle issue, always think about the root cause of the problem, because sometimes you are going to wake up with a lower back issue, but the lower back is not really the issue. It's because something else is not doing the job, and at the end, the lower back is taking the hit. At Mancuso Clinic, we have the habit to see the body from the head to the toe and really try to understand why the problem is and find the root cause of your issue. If you have any question, just book at mancusoclinic.com. You can send us an email at info@mancusoclinic.com and we'll be happy to help you. Have a great day.